everyone, I'm Jessica Johnson. I'm a nurse practitioner in neurosurgery, and I also coordinate the surgical part of our epilepsy program. So, lots of patients have questions about the surgical process and what to expect when undergoing surgery for epilepsy. And so I've put together a small little presentation that, goes over the basics of the surgical process. So that way patients that are thinking about undergoing epilepsy surgery or coming to our center to get worked up for possible epilepsy surgery can have an idea of what to expect. So this is just basically the surgical process timeline. So, once your case is discussed in our patient management conference, and the decision is made by our team that you are a good candidate to have epilepsy surgery, we start with a pre-op visit. That's the first visit that you would have with myself and Dr. Nitin Tandon, the epilepsy surgeon in our group. And at this pre-op visit, we will basically go over all the details of surgery and what to expect as far as post-op deficits or concerns or issues. All that kind of stuff is what we go over in that visit. And then the second visit with us will actually be the surgical procedure itself. And then the third visit would be your 1 week post-op visit. And that happens typically about 7 to 10 days from your surgery discharge. And then the fourth visit with us will actually be a 6 week post-op visit. And then the fifth visit would be a 6 month post-op visit. And at that visit, we redo all your baseline testing. And so I'll go into that in more detail in just a little bit. And in some cases, we do see patients at the year post-op period, but it kind of varies from case to case depending on, clinically what's happening with you or, what's happening with your seizures at that 6 month period. So the 12-month visit is kind of an as needed visit just based on what's happening with your specific case. So this is going to go into more detail about the pre-op visit. So basically your pre-op visit is going to be, the time that you get to know Dr. Tandon, the surgeon, and myself. I'm his nurse practitioner. And then you will also get a physical exam done at that visit. We want to assess your head, we want to assess your skin, and then obviously, any parts of the body that are involved with your seizures, we, are taking a look at that as well. And then we also do, a more holistic assessment. So, we look at your mood. There are a lot of patients that have epilepsy who also may have, depression or anxiety or, some sort of mood disorder. And so, at that point, when we assess your mood, if we feel like you're a good candidate, we have a psychiatrist that works very closely with our group. And so then we would connect you with him at that period so that way you have some time to work with him, before surgery. And then obviously he'd see you after surgery as well. As part of that assessment, it's, taking a look at all the anatomy, looking at your scans, looking at your physical assessment, all of those things come together. And then we obviously get a detailed seizure history, which would include, your type of seizures, how frequent, and what kind of medications you've taken, and all those types of things. And then we also look at your other medical history. So, in addition to, your epilepsy and your seizures, we also want to know, what's going on with your heart and your lungs and, any other medical conditions that could contribute to, your current status. And then, obviously anything that could affect surgery and your outcome of surgery. And so we look at all of those things. At this visit, we also have a detailed discussion about the specific procedure that you're going to have. And then we also talk about expectations, so, a lot of patients, after they have surgery, they want to come off their medications. But, it's very important after surgery to be able to break down that network. And so, we always, talk to patients about that specific expectation because we want, patients to know that surgery, the goal of surgery is to make you seizure free, not necessarily to get you off medications. And so, that's the most important part of epilepsy surgery, to get you seizure free. And then once you're seizure free for an extended period of time, then that's when we would have the conversation about, weaning or discontinuing medications. And typically that conversation happens with your neurologist, your treating neurologist or epileptologist. So, another part of that discussion is, what kind of haircut am I going to get, and how long am I going to stay in the hospital? And, am I still going to be able to walk and talk? And am I going to be able to remember my mom? And so we talk about post-op concerns, possible deficits. And then, in some cases, patients may need a surgery-specific MRI or, a MEG test or a PET test or things like that need to happen before surgery actually happens. And so, we talk about those things. Everybody that gets epilepsy surgery right now also has to do COVID testing. And then, most patients also do anesthesia clearance visits. So, we have you visit with anesthesia so that they can also get a list of your medical history, make sure your heart and lungs and your body are strong enough to withstand surgery. So that's the gist of the, pre-op visit. One thing that we started, I guess it's been several years now, is we started a buddy program. And so, I started this because I felt like there were a lot of patients who needed epilepsy surgery, but were very frightened of the idea of having brain surgery, which I completely understand. And so, I have a long list of patients now who have had epilepsy surgery with us. And so, if you are a candidate for a specific type of surgery, then what we would do is pair you with somebody who's had that type of surgery, so that way you have a buddy that can talk to you about their experience, and then let you know that, hey, this is safe. You can undergo this type of procedure and be okay, afterwards, just hopefully minus your seizures. So, this is something that I think has helped a lot of patients make that next step, being able to talk to somebody that has already been through, that type of procedure, and that can say, you'll be okay. Because as much as I can tell you, or Dr. Channing can tell you, that the surgical, risks are very low, it always feels better to actually talk to somebody who's been through it. So typically how I do this is I would pair you with another patient who's had that procedure. I connect you typically by email first. And then, once you guys start the conversation, then you guys can exchange phone numbers and things like that. And I think it's been very helpful to alleviate anxiety and, nervousness related to surgical procedures. Another big question, especially amongst the ladies, but amongst men too, is what kind of haircut am I going to get? So, it's not going to be this haircut that you see on the PowerPoint slide. I guarantee you that. But, it really depends. So if you're going to have a resective surgery, and what resective means is that you're having your seizure focus area, or the generator of your seizure, removed, then it would be specific to where that's located. So, if you're having temporal lobe seizures, then it would be this small area here that would be shaved for the resection. If you say you have seizures that are coming from your parietal lobe, or the lobe that, creates movement, then you could have an area of your head shaved up here in the parietal area. So as far as resective surgery, the, haircut is directly related to where on the brain the seizures are coming from. If you have stereo electroencephalography, or SEEG, then, if we're trying to lateralize, or if you're getting electrodes on both sides of the head, then typically it is a full head shave. There are some patients who only have to have electrodes placed on, say, the right side of the brain or the left side of the brain. And in those cases, we are able to do a modified haircut, just shaving, the side that we're, interested in and placing electrodes on. But, the ideal plan is to shave the entire head, because we really want to try to prevent infection. We also do another procedure called laser ablation. And in this, it's a minimally invasive procedure where there's just a small catheter that's placed in the seizure focus area, and we use heat therapy to destroy it. And so because it's minimally invasive, typically the area of shaving is maybe about, a $50 or a quarter size. And typically that's in the back of the head, because that's where we typically place the catheter to do the ablation. So there's also neuromodulation that we do, which involves, a placing of a device in order to, modulate, record, or, stimulate the brain. And so in those specific instances, it kind of varies, but typically it's kind of a strange haircut. It would be 2 little areas here, to place leads, and 2 areas in the back to connect the leads to the generator if you're doing DBS. RNS is also, placing leads in a generator. So, it's different areas of the head that are shaved. So, it's ideal to be able to shave the whole head. Dr. Tandon has been able to do some modified haircuts in those cases, just kind of depending on a case-by-case basis, on which device, etc. And then there's also a vagus nerve stimulator, which is another kind of modulator, but there's no haircut needed with that because it just goes to the vagus nerve, and then the generator is on the anterior chest. So you might wonder, what's my length of stay? So how long am I going to be in the hospital, and how long am I going to be out of work or school? So for resective surgery, where we're actually removing the seizure focused area, you're typically in the hospital for 2 to 3 days. And then the overall recovery period is usually like 4 to 6 weeks. And it's not that you're bed bound or you're not able to do things during that period, but it's just, if you go to work or school, we typically say you need off for 4 to 6 weeks for full recovery to get back to full baseline and feeling like, you're up to going to school or work. Laser ablation, because it's minimally invasive, you're only in the hospital for 1 night and you go home the next day. And then typically most patients are back to their baseline or ready to go in about a week or 2. SEEG, or the electrode placement, intracranial electrode placement, you're in the hospital usually for about 7 to 10 days. And this varies a little bit just because, we're really keeping you in as long as we need to so that we can get all the seizure data, mapping data, and things like that we need during that period. But on average, I would say it's probably about 7 to 10 days. We also do a more invasive type of electrode called grids. And if you have grids done, then the evaluation, once they place the grids, is 7 days in most cases. And then at the end of that 7-day evaluation, you would actually get the resection of your seizure focus. And so then after that resection, you'd be in the hospital for 2 to 3 days. So it's about 7 to 10 days for a grid patient. And then for neuromodulation, if you do VNS, which is the vagus nerve stimulator, that's just an outpatient procedure. So you're in, early in the morning, and then you typically get released that same day at about 2 or 3 in the afternoon after they feel like, you're back to your baseline and you're doing well. For the responsive neurostimulator, or RNS, you're usually in the hospital for about a day, and you get released the next day. For DBS, that's actually a 2-part surgery. So for the first part, we place leads. And so for that, you would be in the hospital overnight or 1 day. And then the phase 2, or the second part, when they connect the leads to the generator, you would actually be just an outpatient. So you go home the same day. So for post-op concerns, lots of people are worried about pain, which, is monitored very closely while you're in the hospital. And, they won't release you to go home if your pain is not under control. So hopefully that brings you some amount of comfort. But we will definitely send you home with pain medications. And, you can call us if there's any issues. We can always work out a different kind of pain management regimen as needed. Some patients may have constipation after surgery. And so that's, taken care of by prescribing stool softeners. And that usually happens because of the anesthesia that you're administered during surgery. And then post-op, you're taking pain medication. So that always kind of slows the GI tract down, but we can manage that with stool softeners and laxatives as needed. Rest, so for each surgery, it's a little different what the recovery period is like. But, typically for all of them, the first week, we don't want you doing any heavy lifting. And we just want you to rest and take it easy for the first week. And then the second week, you can slowly start to get back into your normal activities. There may be some jaw tightness. So especially with like the stereo EEG and the temporal lobe resections, there's manipulation of the, muscles or, this area. And so because this is all connected, sometimes you might have jaw tightness or soreness here. We'll have some exercises that we can give you usually at about 3 to 4 weeks after surgery that will help loosen that up. It's not something that's permanent. It's something that's just temporary after surgery that we'll work through. You may have some general weakness, just because surgery overall is, hard on your body, but it's not anything that's permanent. It's just something that's, the first couple of days after surgery, you might feel a little weak and tired. As far as incision care, there's not really anything special that you'll need to do with any of the incisions after surgery. We really take care of all of that. So for the week after surgery, you would keep your incision dry. And then when we see you at the 1 week post-op period, we would actually remove your stitches. And then you're typically stitches or staples. And then you're typically able to wash your head within 24 to 48 hours after the stitches come out. And then you don't need to clean with hydrogen peroxide. You don't need to apply Neosporin. You don't have to do anything really. You just wash it every day and keep it nice and dry. And then, dehydration, sometimes after surgery, you don't feel great, or, maybe you're nauseated because you're not drinking immediately after, or you're nauseated from the anesthesia after surgery. So you're not wanting to eat or drink. And so some people might get dehydrated. And so we always stress to make sure you drink a lot of fluids after surgery. And same with eating, nutrition after surgery is very important because we want to make sure you have all the vitamins and minerals your body needs in order to help heal from the surgery. So deficits, that's a huge thing. If I have this brain surgery, what's that going to do? Am I going to forget my mom's name? Am I going to forget how to walk? Am I going to have a permanent caregiver? And so I think one thing that's very important to remember is that, our goal, as a team and, as Dr. Tandon being the surgeon, as me, as a nurse practitioner, all of us, our goal is to make you better off, not worse off. And so, we don't want to give you a surgery to get rid of seizures, but then cause you some sort of other deficit that then keeps you in the same place. We want to be able to get rid of seizures, but leave you as you. And so, each surgery carries its own set of possible deficits. And so that's a conversation that we would have in depth with you before we even move forward with surgery. So, if you have a temporal lobe resection, what does that look like after surgery? If you have a parietal lobe resection, what does that look like, after surgery? And so that's a conversation that we would have in depth, before we move forward with anything. So that you feel comfortable and you're educated about what to expect after surgery. But, honestly, I would say probably 90% of our patients don't typically need any kind of rehab after surgery. If there are things that we need to order as far as rehab, then, of course we'll do that and get you through whatever, deficits or issues you might have. But they should all be something that's expected that we discuss beforehand before moving forward with surgery. But yeah, we try to tailor each surgical plan very specifically so that, we leave you in the best possible condition after surgery. So, pre-op testing and appointments, we kind of went over this a little bit, but in most cases, there's specific MRIs that we need. based on the type of procedure we're doing. So if you get a deep brain stimulator, or you have, the SEEG or the stereo electroencephalography, there are certain protocols that we use for surgical planning. And so most patients do have to get an updated MRI when we make the decision to do surgery. We talked about the anesthesia visit. We want to make sure that your body is nice and healthy and that you're able to withstand having surgery. COVID testing, we typically do that 3 days before your surgery, or, if you're from out of town or from somewhere far, then we typically do a rapid test on the day of. And then, in some cases, depending on age and your medical history, we may have to do, a cardiac clearance or a primary care physician clearance, because we understand that there are some doctors that have been seeing you for a long, long time. And so, we just want to check with them, touch base with them, and make sure that they feel like you're nice and healthy and strong and that you'll be able to withstand surgery. So the follow-up appointments, just going into these in a little bit of detail, your 1 week post-op visit is typically for stitch removal and for a general wellness check to see how you're doing and check on, your seizures activities. Hopefully you say that there's nothing. And then your 6 week visit is for an incision and wellness check. And then we have another visit at 6 months, but in between there, we would like you to see your epileptologist or your neurologist so that they know what's going on. They know you've had surgery and they can kind of keep a little log of how you're doing, so that once you do get to that 6 month or year period, then they feel confident in, starting to wean or change medications. When we see you at the 6 month visit, it's mainly for a wellness check, but at that visit, we also repeat an MRI to make sure everything's healed from surgery. We do a routine EEG, which is like a 30-45 minute EEG, just to make sure all the brain activity looks nice and quiet and good. And then we typically do the neuropsych testing and formal visual fields if we need to. And that's based on your surgery type. So we redo all those tests to make sure everything looks good post-operatively, and if everything does, then we would release you from neurosurgery follow-up. If there is something that doesn't look right on one of those, or you're still having seizures, hopefully that's never the case, but if you are, then we would most likely follow up with you past the 6 month period. And just as a final, I just really wanted to say that, this is a step-by-step care, really. I mean, we're not going to do surgery and then disappear on you. We've been here for many, many, many years, and we're not going anywhere. So, we'll do this together. If you end up being a surgical candidate, we will be with you through the entire surgical process, and whatever comes up, we'll figure it out and we'll work through it, and I hope that we are able to build a strong relationship throughout this, workup process and throughout the process of surgery, so that, if anything comes up, you're always welcome to give me a call, Dr. Tandon, or our team. We're always here to help you no matter what ends up happening throughout the surgical process. Okay, if you have any questions, let me know. Feel free to contact me. My email is jessica.a.johnson@uth.tmc.edu, and my phone number is 713-500-5443. Take care.